Building on this science and research, we see great strides in the area of public health. Now, public health has its origins in biblical rules on health and hygiene. It also includes principles of safe diet and personal hygiene that was taught by other great religions. Some of the public health pioneers are John Snow, who's thought of as the father of public health. In fact, he effectively brought the end to an 1854 epidemic in Soho, London, by proving that only those who drank from the infected Broad Street pump contracted the disease. Another public health pioneer was Ignace Philippe Semmelweis. He discovered that doctors were spreading childbed fever by not washing their hands in between handling corpses and then going to treat patients. Switching a bit to the issues of surgery, we see that around this time in the late 1850s that the biggest problem with surgery arose around infection that occurred after surgery. Compound bone fractures almost always ended in death because of such infections. Circling back to Joseph Lister, it's again worth mentioning the profound effect he had in helping to decrease infections. His discovery that carbolic acid prevented infections made the setting of compound fractures no longer a death sentence. He also insisted that everything be kept clean and disinfected. As a result, he lowered the death rate in many, many surgeries. Notwithstanding these medical advancements in fighting infection, an area where there wasn't a lot of growth in the 1860s and 1870s was in medical schools. Many were privately owned, operated for profit, and without university affiliation. In fact, the teaching and the quality was so low that physicians often had little to offer their patients other than sympathy and tender care for ailments that they lacked the means to cure. This period of time, medical professionals were held in low regard by the general public. Maybe that's based on what it was like to be a medical student about 140 years ago and looking at the training they received. First, don't worry about admissions. Entrance requirements were lower than they were for a good high school student nowadays. Instruction was superficial and brief. Terms lasted about 16 weeks. And after the second term, the degree of medical doctor was automatically given, regardless of a student's academic performance. Teaching was done by lecture alone, so there were no labs, no clinics, or even trips to hospital wards. In fact, it was not uncommon for students to graduate without ever having touched a patient. Fortunately, all of that changed with the birth of the Johns Hopkins University and Medical School. At Hopkins, a new era of American medicine was born. They instituted a rigorous admissions policy and set quality standards for training university students in the United States that was very similar to European institutions. Candidates for admissions were required to have a 4-year college degree, including 2 years of pre-medical training in biology, chemistry, and physics. They also had to have a reading knowledge of French and German.